I have washed my hands. Good evening. My name is Sarthak. I'm second year medical student from DMSF. Today I am here to take your gyne examination. So before I proceed, may I know your personal details? Unsa among pangalan? Unsa among that?
28.
Unsa among work?
Household.
Unsa among ethnic? Unsa among religion? Are you married or single? Okay. So before I proceed, are you having a female companion with you?
Yes.
Who is she?
My mother-in-law.
Okay. Can you please call her?
Yeah.
Okay. So now before I proceed, I will just ask some important points, questions. Is this your first pregnancy or previously you had been pregnant?
First.
Okay, so means your OB-GYN score is G1 P0. So before we proceed, have you emptied your bladder?
Yes.
Okay. So shall we? I will just quickly explain the procedure. So first I will start with inspection, then I will palpate, then I will perform 4 maneuvers, then I will auscultate for fetal heartbeat and heart rate and rhythm. So shall we proceed?
Yes.
Okay. Please can you read out? Please sit in. Okay, I will just put pillow under your knees. Can you come little forward at the edge? Now I am going to drape you from mid abdomen to the knee. Okay, now I will start the first I will inspect your abdomen. So I can see purplish stray, linea nigra is also present, which is completely normal in pregnancy. The shape is oval, and there is no presence of any scars. So now I'm going to proceed with palpation. So now I'm going to palpate for any masses. So I can note masses, uterus gravid. Now before I am going to feel the fetal movement. May I know that have you ever felt a fetus movement in your abdomen? Okay, so when you started to feel during, okay, so an examiner can also feel the fetal movement from 24th week. So as of now I can feel the fetal movements and uterine contractions. So now I'm going to proceed with different maneuvers. So first is Leopold's maneuver. I will proceed with Leopold's maneuvers. So it will take around 4 maneuvers. So first I'm going to inspect for palpate for the butt portion, which is usually present at the fundus. So I can note a nodular semi-globular mass, which is probably the butt of the fetus. Now I am going to check for the palpate for the extremities and back of the fetus, which is in second maneuver. So okay, in right side I can feel an irregular bumpy structures, which is probably the extremities of the fetus. Now on the left side there is smooth foam like structure which is probably the back of the fetus. Now I am going to check for the head of the fetus. So for that, can you please lay down? Okay, I will be supporting the base by my palms, and I am going to palpate. okay, I can see a hard structure, which is a hard globular structure, which is probably the head of the fetus. Uh, now, uh, now I will check for cephalic prominence, through which we can tell that if the fetus head is flexed or extended. So, as in second maneuver, I have already identified the right side is fetus extremities, and left side is fetus back side. So, I will just palpate. From back side, I can feel the fetus head. So the fetus head is extended. If I can feel through the anterior side of the I can check the cephalic prominence from the anterior side of fetus, means the head is flexed. So now I'm going to proceed with auscultation. So before I proceed with auscultation, I will just note for fetal height. So I will be using the measuring tape for it. I will be placing the zero end at the pubic symphysis, and I will be measuring till fundus. So it is around 36 centimeters. So I will correlate the length of the fetus to the age of gestation. So the length is 36 centimeters, means the age of gestation will be around 36 weeks. So now I am going to proceed with the auscultation. So I will be checking for fetal heart rate and rhythm. So I will be using the stethoscope. I will be using the diaphragm part. As the fetal's back is on the left side, so I will use the left side. So the heart rate is around 110 to 160 beats per minute, and the heart rhythm is around 10 to 15 beats per minute, which is completely normal. Now I have finished with my examination, so you may sit down. Okay, I will just quickly summarize. While inspecting, everything was normal. This is your first pregnancy, so your score is G1P0. Inspection and all palpation was everything normal. I can feel the fetal movements and contractions. So while performing maneuvers, I was able to identify the different parts, fetal parts, which is in correct position as of auscultation. But your fetal heart rate is 110 to 160 beats per minute, which is normal, and fetal rhythm is 10 to 15 beats per minute. So is there any clarification? Okay, thank you.